Well, it's one of the very difficult problems trying to anticipate complications that seem far off in the future and maybe not relevant to the patient. Even simple things like high blood pressure, it's the same thing. The patient may be totally asymptomatic, yet we know if they don't treat it, they may have a heart attack or a stroke or other problems down the road. I think we do our best to try to give them examples, sometimes even show them other types of patients and the things that will lie ahead for them if they don't do this well. And we emphasize that we want them to live a long and fruitful life and one where they can do all of the things they'd like to do. And that requires, unfortunately, some discomfort, inconvenience in managing their disease, but really emphasizing on allowing them to live as normal a life as they can for as long as they can. And that's the message we try to get across.
Very good. Professor Kaldany, we'll come back to you. Now, you mentioned stem cell research. Now, over the last 6 months, we have a very common frequent questions about a center in Germany where they do stem cell transplant. It's the Excel Center. And we had many, and I talked about it many times in our program. I wrote about it and also in the newspapers. And I have actually a few patients, they went there against our advice. So tell us about your experience.
Well, thank goodness none of my patients did. Essentially, this is a new phenomenon, and we call it stem cell tourism, regretfully. And people pretend to be extracting stem cells and giving them to the patients. We have no disclosures that are reliable to understand what cells they are extracting, which cells they are giving to the patients. I know there are techniques that allows you to collect adult stem cells from the patient by doing certain procedures. From all evidence I've seen, none of these procedures, techniques have been done at these centers. So for me, it's a total mystery, and I would be delighted to hear that somebody got better, but I don't.
I actually have 2 patients, they went, and I'm waiting for them to come back.
Yes. You see, it's purely a commercial business, and it's a shame they're allowed to even advertise it in the papers.
Now, and on the other hand, there is like xenotransplant, the animal islet cell and stem cell research, which is happening in Southeast Asia.
Correct.
And we have some few patients who went to there and did that. How do
Any results?
What? I mean, usually no good results.
To my knowledge, this will happen, but I haven't heard it's the right time yet. I'm not aware of any mechanism that works. When you were at Joslin, Dr. Chick had passed away, but he was one of the first who wanted to pioneer this kind of xenograft in a protected capsule type thing. It has not worked, which is a shame. I wish we could find a way to work these things, because diabetes is not a fun disease to live with. It's a difficult disease. But eventually, within our lifetime, inshallah, we will find these answers. But right now, I would be extremely careful if I were a patient.
So that's to concur that it's basically under research, and probably it's better if it's done under centers where are
in the right
known,
place.
In the right place that you have. Now, what happened to the islet cell transplant?
Well, Dr. Weir will be here in 2 days. He will tell you all about it. As you know, the Edmonton protocol was very promising initially. None of the patients have had good results for a long time, as you know. And people are working with different modulations of it. To my knowledge, we will be doing some more patients in the next year, but I have given this answer before. So the FDA always slows us down about when we can start. The question is very complicated. It has to do with dose-benefit ratio. And the other issue, the islet cells themselves, after you implant them, after they multiply, they can continue living, but they lose the ability to keep producing insulin. So that doesn't do you any good to have a healthy islet cell that does not produce insulin. So it's a problem.
Yeah. So it's something that's still not, for everybody.
Not yet.
Not yet.
Not yet.
Not yet. Okay. Professor Schwartzstein, now tell us about your job in this conference. What are you going to talk about?
Well, we've been meeting with people at Dasman Institute as well as at the medical school, talking about ways to teach doctors better to manage diseases like this. Some of that is about understanding ways of analyzing problems when they come up, so they can understand in diabetes, for example, people's diabetes can be out of control if they have a heart attack, if they have an infection, if they're having difficulties with their food intake or their insulin, and you have to be able to discern which is the underlying problem for a given patient. And then again, these communication issues that we mentioned before, how best to begin really training people specifically and explicitly to become better communicators and to work with teams more effectively. So we spoke at length really today, and we'll be meeting again tomorrow with these groups to explain some of the techniques we use for these purposes and hopefully help them implement some of these here in Kuwait.
Professor Kaldany, I know you're an international guy and you're involved in many centers all over the world, and you've been actually one of the building blocks, especially in our area in the Arabian Gulf, in Bahrain, in United Arab Emirates, and hopefully we'll see you more frequently in Kuwait.
Thank you.
Now, tell us about your job in this conference.
Well, it's a pleasure and an honor to work here with the people at Dasman. Dr. Bahbahani has taken control of the center recently.
Yes. Dr. Kaldany Bahbahani.
Dr. Kazim Bahbahani, and you can feel the kind of anticipation of good things to come. I feel Dasman has all the infrastructure they need to become a real center of excellence and for excellence in Kuwait and the region. My role is to support his vision and work with him, and we together collected a group of researchers and clinicians to come and address the group, and I think you will be one of the participants.
Yes.
And I look forward to seeing you again there, and hopefully this will be one of many blocks. And this is not a seminar like any other. It isn't the place where people come, lecture, go away, and forget about it. This is the first step of many, so that a real, true, productive, creative idea building partnership between Joslin, Boston, and Dasman and Kuwait.
Good. And tell us about your experience in United Arab Emirates. You have a new
We have,
Joslin Center.
yes. In April of this year, we opened a Joslin Diabetes affiliate at the Dubai Health Authority. It's a superb center. It's working extremely well. We are hearing superb results as patients are happy and satisfied. The vision of the Dubai Health Authority in supporting it and projecting it for the future has been flawless. We were able to recruit 4 excellent physicians, all American board certified, and all of whom have experience with the Joslin care model. So we brought together this core physician team, and with them we have nutritionists, exercise physiologists, podiatrists, teaching nurses, patient care ambassadors. So the group is complete, and it's built on a platform of an electronic health record, which has embedded in it all the attribute of Joslin care. So essentially, it's a clinic that works so well that people in Boston would be jealous when they see it.
Yeah, and hopefully that will get also
In Dasman.
in Dasman.
I think so.
My guest, thank you for coming
Thank you
to us
very
tonight.
much.
I
Thank
know
you.
you had a long trip and you're very tired, and that's it's a great honor for me to have you tonight on my show, and it's great actually honor to see you again.
Thank you.
Long
I look
time.
forward to it.
Yes, and well, thank you for
Well, thank
having
you.
us
Thank
tonight.
you
Appreciate it.
very much. We appreciate it.
Dear viewers, we'll go out on a break and we'll come back.